Imagine waking up one morning with a sharp pain in your side. You rush to the emergency room, worried, confused, and then the bill comes. Thousands of dollars, just for a few hours in the hospital. That's when it hits you. You need health insurance. But in the US, getting health insurance isn't always simple. It's a maze of terms, providers, and plans. So today, we're going to walk you through the entire process, step by step, so you can get covered with confidence and avoid the nightmare of medical debt. Let's begin with a simple question. What exactly is health insurance? Health insurance is a contract between you and a health insurance company. You pay a monthly premium, and in return, they help cover the cost of your medical expenses. Things like doctor visits, hospital stays, prescriptions, and even surgeries. But here's the catch. Not all plans are the same, and the process to get one can be overwhelming if you don't know where to start. So, how do you begin? Step 1. Know where you stand. Are you employed? Are you self-employed? Do you qualify for government programs? In the US, the source of your insurance often depends on your job or income level. If you're employed full-time, your employer might offer health insurance. This is called employer-sponsored insurance. About 54% of Americans get their coverage this way. If your job provides it, this is often your best bet. It's usually more affordable because your employer pays a portion of the premium. If you're not covered through work, don't worry. That brings us to step 2. Checking the health insurance marketplace at healthcare.gov. This is a government-run website where you can compare different plans and even get financial assistance based on your income. Enrollment usually happens once a year, called open enrollment. It typically runs from November 1st to January 15th. But there are exceptions. If you've recently lost coverage, changed jobs, gotten married, or had a baby, you might qualify for special enrollment. Now, let's talk about choosing the right plan. This is where many people get stuck. On the marketplace, you'll see plans labeled bronze, silver, gold, and platinum. These aren't about quality. They're about how costs are shared. Bronze plans have the lowest monthly premiums, but the highest out-of-pocket costs when you need care. Platinum plans are the opposite. High premiums but low costs when you use your insurance. Silver is the middle ground, and it's the only tier that qualifies for extra savings if your income is lower. Still with me? Good, because this next part is crucial. When comparing plans, don't just look at the price. You also need to consider the deductible. That's the amount you pay before your insurance starts to help. For example, if your deductible is $2,000, you have to pay that much out of pocket before your insurance kicks in. Then there's the copay, small fees you pay for services like doctor visits, and coinsurance, the percentage of costs you pay after meeting your deductible. Also, make sure your preferred doctors and hospitals are in-network. If they're not, your plan might not cover your visits, or it'll cost a lot more. This is a common mistake that leads to unexpected bills. Let's break it down with a quick example. Imagine Sarah, a freelance graphic designer in Texas. She earns about $35,000 a year and doesn't have employer coverage. She goes to healthcare.gov, fills in her income info, and finds out she qualifies for subsidies. A silver plan that normally costs $600 a month now drops to around $120 for her. It covers 70% of her medical costs and includes her regular doctor. That's a win. Now, if you're a low-income individual or family, you might qualify for Medicaid, a state and federal program that offers free or low-cost coverage. Each state runs its own Medicaid program with different rules, so it's worth checking your state's eligibility requirements. In 2024, in most states, if your income is under about $20,000 for a single person or $41,000 for a family of 4, you might qualify. And if you're over 65 or have certain disabilities, You could be eligible for Medicare, which is a separate federal program. Medicare has its own rules and plans, like Part A for hospital insurance and Part B for medical services. Okay, now let's say you've chosen a plan and enrolled. What happens next? You'll get a welcome packet and your insurance card. Keep that card with you. It's what you'll show at clinics, hospitals, and pharmacies. Most insurers also have an online portal or mobile app where you can find doctors, track bills, and manage claims. But here's an important tip. Know what's covered. Even with insurance, not everything is paid for. Some plans don't cover dental, vision, mental health, or certain prescriptions unless you add extra coverage. Read your summary of benefits carefully. It's a short document that tells you what services are included, what you'll pay, and what your rights are. Now let's talk costs. On average, in 2024, an individual health insurance plan in the U.S. costs about $500 per month without subsidies. But thanks to the Affordable Care Act, many people qualify for tax credits that significantly lower this cost. In fact, 4 out of 5 people on the marketplace find plans for less than $10 a month. And don't forget to make your monthly premium payments on time. If you miss too many, you could lose your coverage. Some insurers offer auto-pay options to avoid this. Lastly, stay proactive. Use your plan. Get preventive care. Most plans cover annual checkups, vaccinations, and screenings for free. Don't wait until you're sick to see a doctor. The goal of insurance is to keep you healthy and catch problems early, before they turn into emergencies. So, let's recap. First, decide where you're getting insurance, from your job, the marketplace, Medicaid, or Medicare. Second, compare plans based on premiums, deductibles, and coverage. Third, enroll during open enrollment or after a qualifying life event. Then, review your benefits, pay your premiums, and actually use the services available to you. Health insurance might seem complicated, but once you understand the system, it becomes a powerful tool to protect your health and your wallet. If you found this video helpful, do me a quick favor. Hit that like button, drop a comment with your questions or experience, and don't forget to subscribe for more clear, useful guides like this. Your support helps us reach more people just like you. Thanks for watching, and take care of yourself out there.